Hi, I'm Dr. Michael Carlston. Let me start this out with a disclaimer. First off, I give shots. I give them myself. I give them my office. I'm the one who administers them, not a nurse, me. I feel that vaccinations are useful at times. State Bill 277, the mandatory vaccination law bringing California into line with Mississippi and West Virginia, has passed. With apologies to West Virginia and Mississippi, I really don't like it. I really don't like it when the word mandatory comes into healthcare. That's because it means someone else has taken it upon themselves to decide what is good for you. They think that they know that it's really for the best. The problem with that attitude is it's been proven wrong again and again and again, and is proven wrong again every day in medicine. They absolutely do not know what's right for you. Nobody does. In fact, we all make mistakes all the time. That's just simply how it happens. Do you remember other drugs that you may have heard of, things like fen-phen, Vioxx, Bextra, DES, thalidomide, things like that? They were all common drugs that killed people. How about Seldane? It was the first antihistamine that didn't make people sleepy. It also caused fatal heart arrhythmias. That's why you don't hear about it anymore. These medications worked fine for most people. The problem is that rare bad reactions happen to every medication. And if enough people use whatever it is, whatever the treatment is, some of them will die from the treatment. To bring this back to immunizations, we could talk about the paralytic disease Guillain-Barré that has been associated with influenza vaccines and hepatitis vaccines. But the best example is the HPV vaccine for venereal warts. It's the best, newest example. The government of Denmark has asked the European Union to investigate adverse reactions in the 87 million Europeans who've received the vaccination. Why are they doing that? What's the reason for this? Well, some unusual debilitating nervous disorders seem to be caused by the vaccine. A new study just came out about this a while ago, and then the EU decided, the Denmark and then the EU are deciding to look into it. One of the problems is a chronic pain condition. The other is a disorder that throws a monkey wrench into the body's heart and blood pressure regulation system. It's called POTS. I know of a young man who has this disorder who has gone from competing for a spot on the Olympic team to collapsing after he tries to exercise. His case isn't related to the HPV vaccine, but it demonstrates just how disabling the syndrome is and how bad the consequences can be from using a vaccine that authorities proclaim is perfectly safe. The bottom line is quite simple. Mandatory is a bad word. The arrogant overconfidence and naivete driving this push to take away our rights to think for ourselves is dangerous.